everyone, and welcome to my YouTube channel. I am Nurse Patience. In today's video, I will be discussing 5 bedroom tips on getting pregnant. Please, if you are yet to subscribe to this channel, kindly hit the subscribe button and do not forget to turn on the notification button to enable you get updates from us whenever a new video is up. If you are a returning viewer or subscriber on this channel, I am saying thank you. So the number one tips on getting pregnant easily is timing. What do I mean by timing? Timing is knowing your menstrual cycle so well and knowing those days you are most fertile. The average cycle length for most women is 28 days, although the cycle length starts from 21 days and it ends at 31 days. This is all the variations in cycle length. There are some women that may have a cycle length of below 21 days and greater than 35 days. If you fall in under such category, that shows that you have an irregular cycle. Your menstrual cycle, it is not all day during the menstrual cycle that you are fertile. On the day of ovulation is the day you are most fertile. Although you are not going to just take or have sexual intercourse during the day of the ovulation. What you do now is you get a calendar, you count your cycle length. For you to be able to know this day you are most fertile, you have to first know your cycle length. And if you don't know how to calculate your cycle length, I'm just going to give you a brief explanation here. I have a detailed video on the same channel for that particular course in this channel. So to know your cycle length starts from the first day you start bleeding. That's the first day of menstruation, and it ends at the last day before the next period begin. Okay, so averagely, like I've said, the cycle length of a woman is 28 days. If a woman is having a cycle length of 28 days, say for example, what you do now to get your day of ovulation is you subtract 14 from 28, which will give you what? 14. So on day 14 of her menstrual cycle, that woman would be ovulating. And how can she have sexual intercourse that will lead to pregnancy during this period? That's when the knowledge of timing comes now. You would not just be having sexual intercourse during the day of ovulation. What you do is you add 2 to that day you are ovulating, then you subtract 2. By that, what I mean is you start from day 12 of your cycle length now, then you end your sexual activity on day 16. Yes, so 14 is the main day the woman is ovulating, so you add 2 days. That's 2 days before the ovulation day you can start sexual activity. Why you take it, you also go further by adding 2 extra days after the ovulation day, because what happens is the sperm can last for about 5 days. That's 72 hours approximately in the body of the woman, and this egg, once it is released, the egg takes minimum of 12 to 18 or 20 hours before this egg depreciates. So if you use this period very well, it will definitely lead to pregnancy. The second tip I want to share here is know and use the right conception friendly lubricants. Yes, there are some lubricants that are not fertility friendly. Lubricants such as saliva, petroleum jelly, the normal commercial lubricants that is being purchased or sold in the market, some of them have ingredients that do not support the sperm, and most times they tend to kill or lyse the sperm before it gets even into the cervix. So what you need to watch out for if you want to get a lubricant is to check out for the ingredients that have been used in the manufacturing of such a lubricant, or search for hydroxyl ethyl cellulose based lubricants. These are very sperm accommodating, and they do not kill the sperm, but they promote the sperm movement. So you check for those things and it would help you. The third point is, most women think after sexual intercourse they need to remain in bed for 30 minutes, or they elevate their leg to ensure that all the semen that have been deposited by the man gets into them. But one thing you need to know is, upon every ejaculation, most sperm now are being deposited very close to the cervix, such a way that the most active, the most healthy, the most fastest sperm gets to meet with the ovum. So you do not need to stress yourself staying in bed or elevating your leg after sexual intercourse. One thing you need to know is the quantity that is required for conception have actually gone inside dead sperm cells that could not make their way there, because the lucky one have gone inside. So you do not need to stress yourself with the whole idea of elevating your leg or lying down for 30 minutes. And it is also important that after sexual intercourse, you try to pee and what, clean yourself up. This would prevent you from coming down with infection. The fourth point is, create a warm, calm, and soothing environment. By warm, calm, soothing environment, what do I mean? You invest in soft lighting, good beddings, comfortable ones. You also invest in good scents that would just lighten the whole environment. And most studies have shown that the calmer the environment, the more the tendency for intimacy. So an environment that is calm and welcoming would encourage and promote intimacy, and that particular environment is the one you're supposed to be having around your house if you want to conceive. Then the last point is positioning. By positioning, you can use or explore whatsoever position you want. As far as intimacy is concerned, you do not need to choose a particular position, provided the position you are using will get the sperm deposited very close to the cervix. It does not matter what position you want to explore, but if this would lead to ejaculation and there will be deposition of the sperm very close to the cervix, then it is fine. If you have been trying to conceive for up to a year and you are more than 35 years, please, you try and see your gynecologist, as there are some tests and screening that needs to be done for you to be able to fasten this process. And if you are below this age and you have been trying, let's say 25, you are below 35 years and you are trying to conceive for up to 6 months, you should also see your doctor. There might be something or an underlying cause that needs to be addressed. If these are the kind of content you like watching, please do not forget to subscribe to my channel and do not forget to turn on your notification button. Thank you.